Assalamualaikum warahmatullahi wabarakatuh and a very good morning to fellow audience. Today I stand before you to give meaningful presentation regarding to chemotherapy side effect. So first of all, my name is Ahmad Ibrahim bin Abdul Hali and I will be giving brief introduction on chemotherapy. So generally, chemotherapy is a drug treatment that uses powerful chemicals to kill fast-growing cells in your body. Chemotherapy is most often used to treat cancer, since cancer cells grow and multiply much more quickly than most cells in the body. Next question, why does chemo cause side effect? Cancer cells tend to grow fast, and chemo drugs kill fast growing cells. But because these drugs travel throughout the body, they can affect normal, healthy cells that are fast growing too. Damage to healthy cells causes side effects. Side effects are not always as bad as you might expect, but it's normal to worry about this part of cancer treatment. The normal cells most likely to be damaged by chemo are blood-forming cells in the bone marrow, hair follicles, cells in the mouth, digestive tract, and reproductive system. Some chemo drugs can damage cells in the heart, kidney, bladder, lungs, and nervous system. Sometimes you can take medicines with the chemo to help protect your body's normal cell. There are There are also treatments to help relieve side effects. Doctors try to give your chemo at levels high enough to treat cancers while keeping side effects at a minimum. They also try to avoid using multiple drugs that have similar side effects. So, another question to ask, what do we need to know about side effects? First, every person doesn't get every side effect, and some people get few, if any. Second, the severity of side effect, how bad they are, varies greatly from person to person. We need to be sure to talk to our cancer team about which side effects are most common with our chemo and how long they might last, how bad they might be, and when you should call the doctor's office about them. And the third one is your doctor may give you medicines to help prevent certain side effects before they happen. The fourth is some chemo drugs cause long-term side effects like heart or nerve damage or fertility problems. Still, many people have no long-term problems from chemo. Ask the doctor if the chemo drugs you're getting have long-term effects. Another question to ask is how long do side effects last? Many side effects go away fairly quickly, but some might take months or even years to go away completely. They are called late effects. Sometimes the side effect can last a lifetime. Sometimes when chemo causes long-term damage to the heart, lungs, kidney, or reproductive organs. Certain types of chemo sometimes cause delayed effects such as second cancer that may show up many years later. People often become discouraged about how long their treatment lasts or the side effect they have. If you feel this way, talk to the cancer team. You may be able to change your medicine or treatment schedule. They also may be able to suggest ways to reduce any pain and discomfort you have. Now, the most interesting part in my presentation, which is the main body, which is the common side effect of chemo. First of all, most people worry about whether they'll have side effect from chemo, and if so, what they'll be like. Here are some of the most common side effects caused by chemotherapy. Number one is fatigue. Next, hair loss, easy bruising and bleeding, infection, anemia, which is the low red blood cell counts, nausea and vomiting, appetite changes, constipation, diarrhea, mouth, tongue, and throat problems such as sores and pain with swallowing, peripheral neuropathy or other nerve problems such as numbness, tingling, and pain, skin and nail changes such as dry skin and color change, urine and bladder changes and kidney problems, weight changes, chemo brains, which can affect concentration and focus, mood changes, changes in libido and sexual function, and fertility problems. Another point I would like to add in my presentation is chemotherapy, drug interaction, and side effect. When looking at how best to combine chemo drugs, doctors must look at interactions between chemo drugs and other medicines the person is taking, including over-the-counter medicines, vitamins, and supplements. These interactions may make side effects worse and affect how well chemo drugs work. For instance, platelets help blood clot and prevent bleeding. Many chemo drugs lower the number of platelets for a time. Taking aspirin or other related drugs can also weaken blood platelets. This isn't a problem for healthy people with normal platelet counts. But if a person has low platelet counts from chemotherapy, this combination might put them at a risk of serial bleeding problems. Another point that should be included in my presentation is how vitamins affect chemotherapy drugs. Many people want to take an active role in improving their overall weight. They want to help their body's natural defense fight the cancer and speed up their recovery from chemo. Most people think of vitamins as a safe way to improve health, so it's not surprising that many people with cancer take high doses of one or more vitamins. But some vitamins might make chemo less effective. Of course, more research is needed, but until more is known about the effect of vitamin on chemo, keep these points in our mind. First, if the doctor has not told you to take vitamins, it's best not to take any. Second, always check on your doctor first before starting to take a vitamin of any kind, even a simple multivitamin. Ask the doctors if and when it might be okay to start taking vitamins after treatment. Fourth, if you are concerned about nutrition, you can usually get plenty of vitamins by eating a well balanced diet. Next question to ask: when to call your cancer care team about chemo side effects? So, because your cancer care team will give you lots of information about side effects, you might be more aware of physical changes. Do not take any physical symptoms you have lightly. Some side effects are short lived and minor, but others may be a sign of serious problems. Make sure you know how to reach someone on your team anytime, including after hours, weekends, and holidays. Contact your cancer care team right away if you have any of the following symptoms during chemo treatment. If you have several symptoms like a fever higher than what your cancer care team has instructed, usually it's increasing the temperature. Next is bleeding or unexplained bruising, a rash, and allergic reactions such as swelling of the mouth or throat, severe itching, or trouble swallowing. Another symptoms that have to be considered are intense chills, pain or soreness at the chemo injection site or catheter site, unusual pain, including intense headaches, shortness of breath or trouble breathing. If you're having trouble breathing, call 911 first. Long lasting diarrhea or vomiting, and bloody stool or there is blood found in your urine. So, as the conclusion, it is important for us to know basic knowledge on chemotherapy and the side effect so that we'll become more careful in the future. So, to end up my presentation, I would like to thank you everyone for listening to my presentation and have a good day. Assalamualaikum and see you again.